to the Council on Aging this morning for a presentation on medication storage and disposal. We have a great panel of presenters today. We have Dr. Pope from St. Luke's Hospital, Detective Kyle Costa from the Dartmouth Police Department, and Erica Hanks from Community Nurse.
My name is Jennifer Pope. I'm an emergency physician at St. Luke's, and I work in the department there as well as run the department. I'm really excited to be here today, and thank you for coming out on this rainy day. I wish it was a little bit of snow. I might be the only one who wishes that, but no snow. All right. Well, good morning. This is a very informal talk this morning, but I'd like to talk a little bit today about prescription medications, over-the-counter medications, combining medications, and the effects of alcohol and other pain medications with your regular medications. If you have any questions, please just shout out. It's very informal, and I really want to make sure I answer anyone's questions this morning. So, as you probably know, on average, people over 65 take about 7 to 8 medications a day, and that's on average. I'm sure some of you know people who take up to 20 medications a day, and then there are a few who maybe just take 1 or just a vitamin. But it can be very confusing, and these medications are very important. They are given to people to treat certain diseases like high blood pressure, pain, diabetes, Parkinson's. But with all of these medications, there also come side effects that may be unattended and we may not be aware of because we are being told by our providers that these medications are to treat our blood pressure or to treat our anxiety. And we don't always necessarily know the side effects of these medications. As we get older, our body changes, and with that comes changes in the way we process all of these medications and alcohol. Changes to our digestive system as we get older causes the delay effect of absorbing the medications, and that can have a more intense effect on the body. Also, changes in weight can affect how much medication or alcohol we can tolerate. The circulation system also slows down, which affects how fast medications or alcohol will get to the kidney or liver to be metabolized or broken down. And then there are other issues that come as we get older, including now you're taking multiple medications, keeping track of those medications. You may have multiple providers or doctors, and do they know what medications you're on and how that will interact? And then how do you keep track of your medications? This is very complicated. You may have multiple bottles, and all of this can affect your body and how you feel. So first, I'd like to talk about some medications that are commonly taken. In fact, some of you in the room may take them, and some of the known side effects that, when just taken as prescribed, can happen, but it's important for you to be aware of. So the first medication I'd like to talk about are the Benzodiazepines, or oftentimes the anti-anxiety medications. I'm going to use some words for medications to see if they ring any bells, but Valium, Xanax, those are some of the commonly prescribed medications for anti-anxiety or muscle relaxants. These can, at regular dosing, cause confusion, sleepiness, and falls. And as you all probably know, people who fall can break a hip, which has long-term sequelae, or hit their head and cause bleeding on the brain that can sometimes be devastating. And so it's important to know that if you take these medications, that these are common side effects. I will also say some of these medications cause the body to become dependent on them. Benzodiazepines are one of them. I will never forget a patient I had in the emergency room recently. It was a lovely 91-year-old female who lived at home with her husband. She came in early one morning about 5:45 for some chest pain. She was brought in by ambulance. I was able to speak with her. Her pain had resolved in her chest, But as I was leaving the room, she was antsy and started to shake a little bit and looked uncomfortable. And I said to her, "Are you okay? What's going on?" She said, "Can I have my Xanax, please? Someone gave me Xanax 25 years ago and promised me I would never become dependent on it, but that is not the case." And so she was experiencing side effects of anxiety, tremulousness, feeling uncomfortable in her own body because she didn't have her regularly scheduled dose of benzodiazepine. And so for some of these medications you can develop a dependency to that will also cause side effects. Another group of medications that are commonly used are some of the antidepressants. Amitriptyline, which is also used for a sleep aid, doxepin. These medications can cause confusion, it can lower your blood pressure, it can cause urinary retention, and all of these things can lead to falls. So it's important to understand what medications you're taking. And I just want to put this aside. This is not to say you should not take these medications. Some of these medications are very important to your health and well-being, and it's just very important to talk to your doctors about them and to know the potential side effects for them and to take them as prescribed. There are some other group of medications like antihistamines. Now these are over-the-counter medications like Benadryl. These medications can have what we call an anticholinergic effect, or it can cause confusion, dry mouth, urinary retention, sleeplessness. And so it's important to know if you develop an itchy rash and decide to take Benadryl to really take it as prescribed. Just because the rash doesn't go away doesn't mean you should take more. Because in fact, if you take too much of Benadryl or the antihistamines, you can actually get quite sick, where you're jittery, you're anxious, dry mouth, you get confused, you can fall, you will not be able to urinate. And again, these are known side effects for these medications. So it's very important that you look at the labels and talk to your caregivers or physicians about the medicines you take, even the over-the-counter medicines. Another group of commonly taken medications are the anti-nausea medications, Phenergan, Compazine. These can also cause low blood pressure, can make you very sleepy, and it can cause some involuntary movements. And again, this can happen at regular doses. And so imagine if you were to take an anti-nausea medicine like this, and we're already on an antidepressant, that the synergistic effect of these two medications could make you very confused, feel off balance, and maybe cause you to fall. And so it's important when you're given a new medication to talk to your provider and your pharmacist about this, and I'll talk a little bit more about that in a little bit. Another group of medications I'd like to talk about are pain medications. When we say pain medications, I think obviously in the media, in the news, you hear about opiates and heroin and the epidemic that we are experiencing across the nation and here in Dartmouth and New Bedford. But there are all sorts of pain medications. There are opiate pain medications and there are non-opiate pain medications. But they can cause constipation most commonly. They can also cause confusion and sedation. And so I can only imagine that as you get older, you get quite a bit of arthritis and probably deal with pain on a regular basis from sore joints or sore back. And that can be very debilitating. It can cause depression and can be very frustrating. And so it's important to talk with your physician about alternatives to pain management, things like lidocaine patches that just go on the skin to help with pain, injections through a pain center or a spinal center to help with back inflammation, and also orthopedic doctors who will do joint injections to help with pain. Because again, some of these even mild pain medications can cause significant sedation, constipation, confusion, and in fact, if you add other medications to your pain medication, it may cause you to fall, hit your head and have a brain bleed, and even sometimes decrease your breathing, which can lead to people not waking up again, your heart stopping, and death. There are another group of medications to treat Parkinson's, the Cinnamate medications, if that rings a bell to anyone, that can also cause low blood pressure and dizziness. And then even some of the medications we take to treat our heart, digoxin, hopefully rings some bell to people, and warfarin. Digoxin at regular doses can cause nausea. When digoxin levels get high, it can cause vomiting, confusion, changes in your vision. And then there's Coumadin or warfarin and other blood thinning medications that are very commonly prescribed. These need very close monitoring, and food can affect it. Other medications can increase your Coumadin levels in your body. The last group of medications I just want to mention are some of the urinary incontinent medications. Again, very commonly prescribed and can make a big difference in someone's lifestyle to help with their urinary incontinence. But again, at regular doses, these will cause dry mouth, they can cause constipation, and at higher doses can cause confusion or delirium. And so it's important to recognize that if a loved one has some changes in their mental status, to really look at the medications that they're taking, because it just may be the fact that they started on a new medication to help with their urinary incontinence, and it's causing some symptoms for them. So these are just some commonly prescribed medications and the routine side effects. Now imagine if you start taking medications on your own without talking to your doctor. Oftentimes, it's frustrating because you can't get into your provider as quickly as you would like, or you're having symptoms in the middle of the night and want to do something about it. I would just caution you on the dangers of self-prescribing medications to yourself, whether it be taking someone else's medication or even some of these over-the-counter medications. If you don't understand the full regime of medications that you're on, adding one more medication could be dangerous because you don't know all of the side effects that could happen. Please, I urge you, if you're having problems, to talk to your providers. Also pharmacists. Pharmacists are readily available, and I think they're really an underused resource in our community. They're there at the grocery store, they're there at our local drugstores on the corner. If you have questions, they are the experts in these areas of medications and medication interactions. Please talk with them before taking any other medications, just to keep yourself safe and to not cause side effects that will make things worse for you. Also, the dangers of taking someone else's medications. Quite frankly, you don't know what's in those bottles. And I think it's important that you talk to your providers before you do anything like that. I just want to mention now, talk a little bit about alcohol and the effects of alcohol with these medications. So there was a study done in 2015 out of the Institute of Alcohol Abuse and Alcoholism that found that 78% of people 65 years or older drank alcohol and took alcohol interactive medications. Now, the definition of an alcohol interactive medication is a medication that is affected by mixing alcohol and affects the metabolism of the drug or the effects on the body. So, as I'm sure you're all aware, long-term heavy alcohol use can be dangerous for your liver, your heart, and your brain. But it's important to realize that when you are on medications like the one I listed, even having 1 drink or 2 drinks of alcohol can increase your risk of falls, which can lead to hip fractures or bleeding on the brain, can increase your risk of accidents, can cause irregular sleep cycles. So if you're already having a hard time sleeping and you're drinking alcohol before bed, you actually may have a worse time trying to sleep at night. You may initially fall asleep, but you will wake up sooner than expected. And it can cause forgetfulness. Some important medications to think about when you're combining alcohol is if you take aspirin on a daily basis and you drink alcohol, this will increase your risk of bleeding in your intestines, causing black or bloody bowel movements. If you take over-the-counter cold or allergy medications, these medications often have an antihistamine in this. When you combine this with alcohol, you can have increased sleepiness. You can be very unsteady on your feet, leading to falls. If you take acetaminophen or Tylenol on a daily basis to help with pain and drink alcohol on a daily basis, this can cause damage to your liver. Some of the over-the-counter cough syrups, and this is very important. Over-the-counter cough syrups, one, quite frankly, are not that effective. They will not stop you from coughing. Oftentimes they have what's called dextromethorphan in them, which is basically a form of alcohol. So if you have a drink or two, and then you take your cough syrup before bed, it's like having 3 or 4 or 5 alcoholic drinks. And so that's very important to remember when you go to the local store looking for an over-the-counter medication. And then the last, and potentially most deadly combination is alcohol, opiate pain medications, or the benzodiazepine medications like the Valium or the Xanax. These are sedating medications, and if you take too much of them, you can have an overdose. I know we think of the word overdose when we think of heroin or other recreational drug use, but this is what can happen if you combine alcohol and some of these prescribed medications. It causes sleepiness, it can decrease your breathing or your respiratory rate, and if it does so to an extent, it can actually stop your heart. And so unfortunately, this is something that we see in the emergency room. Yes, we see people battling with substance use disorder, but we also see people who accidentally combine their medications, maybe have a little bit of alcohol, and actually come in distress or in cardiac arrest from an accidental overdose when they combine medications. So it's important to know that it can happen to you as well. What do you need to know today about these things? Well, one, talk to your doctor and your pharmacist about your prescriptions. You need to carry around a list with you of all the medications, including over-the-counter medications that you take. Bring that list to your doctor, to your nurse practitioner, to your pharmacist, and please review that medications list with them so everyone can be on the same page. Your providers can know how to treat you and can watch for potential interactions, and you yourself can feel safe and comfortable with the medications that you're taking. Ask your pharmacist or doctor about any of the over-the-counter interactions or food interactions with these medications. Limit your alcohol consumption. I'm not here today to tell you never to drink again. That's not my intention. But my goal is to keep everyone safe. And so please be aware of the medications you take and talk to your doctor about whether small amounts of alcohol are safe for you. Use a pill box. Or if you have a smartphone, there are apps now that actually help remind you to take your medication. I would encourage everyone who takes more than one medication to use a pill box. It's a way to keep yourself organized. I do it for my dog, right? Why should we not do it for ourselves? And it will remind you when you've taken them, when you haven't, and it will keep your medications organized. Make sure your pharmacist has an updated list of your medications. Because your pharmacist is also there for a double check to make sure that you're safe. We get calls all the time from pharmacists saying, hey, I just want to make sure that you actually do want to prescribe this because I see they're on this. And that's a great double check for me as a provider and a physician in the community to make sure I'm keeping you safe. So please make sure your pharmacist knows everything you're taking. And then again, watch for side effects and interactions with over-the-counter medication. Although they are over-the-counter and they're deemed to be safe, they will have side effects, and when combined with other medications, can cause serious effects. Other small things to keep you safe are, instead of looking for a sleep aid, think about your sleep cycle. Try to wake up and go to bed at the same time. Limit napping during the day. Avoid caffeine after 12 o'clock in the afternoon. Avoid alcohol before bedtime, because although alcohol will help you fall asleep, it will not keep you asleep and actually will cause early awakenings. In terms of urinary incontinence, it is a struggle that many people have and can impair your activities of daily living. And so make a scheduled time to go to the bathroom. Find a bathroom every 2 hours. Talk to your doctor about other exercises that you can do. And again, for pain management, please talk to your doctor about alternatives. Pain can be devastating when experienced on a daily basis. And there are other non-narcotic options out there, including patches, injections, massage, other ways to help keep minimizing your pain, but also keep you safe. Thank you for having me today.
Thank you very much.
Good morning, everybody. My name is Kyle Coster. I'm a detective with the Dartmouth Police Department. I want to thank Amy for inviting us in today, and thank all of you for taking time out of your day to listen to this beneficial talk. First and foremost, any veterans in the room? Just like to acknowledge our veterans today and just take a moment to remember Pearl Harbor. Dr. Pope's always a tough act to follow, but they always seem to put me on right after her. I've been a police officer for about 25 years now. I've been in detectives for about the last 4 years. I grew up in Dartmouth. Thank you. I grew up in Dartmouth, so I'm a Dartmouth kid at heart. When the opioid crisis kind of took shape a few years back, Dartmouth saw a slow turn in obviously our activity in crime, the way that we were dealing with certain things. And it brought us to a point about a year ago where I was approached by Chris Michaud from the Board of Health, who I'd like to acknowledge. And we started a group called COPE. It's Community Offering Prevention Through Education. A few stakeholders in it are sitting here today. Obviously, Chris Michaud, who is he's always the man behind the scenes and doesn't get enough credit. So I'd like to acknowledge Chris, as well as Jen Cabral, our youth advocate in town. Back in January, we really, the police department actually really started to reevaluate how we were handling things. Obviously, we're going to be the ones that are on the forefront. We're the ones that are always getting there first, finding out what's going on. And we saw a huge spike as far as the opioid-related activity. We kind of addressed it, how can we do something, and how can we do it better? You know, as cops, I hate to say it, our thing was you show up, you take a report, you leave. You don't really think about the aftermath or what you can do maybe to prevent that from happening at all. I approached our deputy chief as well as our chief, Brian Levesque. I'm sorry, that's our deputy chief in the back, Brian Levesque. Brian was a key player in developing the programs that we put in place at the police department, as well as discussing with Chris and a few other people on, again, how we could do it better. In January, I contacted CVS, and they were wonderful. I wrote a grant. They got us a drug drop-in, or a drug drop box. Now, has anybody seen that? Do you follow us on Facebook? Have you heard about it?
Yes.
Anybody? Okay. How many people here are able to mail a letter? Everybody here has mailed a letter? Okay. I have to. I know with the email we're kind of getting away from it, but everybody's capable of picking that, opening that box, dropping a letter in, and saying goodbye. Am I correct? That's what our drug drop box is, to be quite honest with you. It's that simple. You bring any unused, unwanted medication, and it's a responsible way of not only doing away with that medication in an environmentally responsible way, but it also takes opioids or opiates or any unwanted medication out of the house. When people think of house breaks, let me just ask this question. We have a lot of years in this room right now, including my own. When you think of a house break, what do you think of when somebody breaks into a house?
Drugs.
Drugs, money. Do you see how we're all kind of turning? How many people here would have said drugs 5 or 6 years ago?
No.
Probably not a heck of a lot. You would have thought of your jewelry. You would have thought of your computer, correct? Yeah. Now I've already heard, you know, this generation, and I hate to categorize you guys as the greatest generation, but you are. The greatest generation is now thinking of drugs, and that's what we think of first and foremost when we go into these houses. You're going through, you are still seeing the house ransacked, but what are we seeing a lot more of now that we didn't see in days past? The medicine cabinets open, yeah. Or the cabinets have been gone through looking for medications. It happens. Unfortunately, that's what we're dealing with on a daily basis. When a pill on the street now can garner anywhere from $5 per pill to $30 per pill, there's a huge market for it. And that's what we're up against. That's what our narcotics guys are up against. That's what detectives are up against. That's what the guys on the street are up against. The doctors, everybody. It's affected everybody. So we thought of a way of, well, let's get the pills out of the house. We got the drug drop-in back in January, and since that time we've collected, January of this year, we've collected nearly 200 pounds of unused or unwanted medication in Dartmouth alone. 200 pounds. Now when you look at the average weight of a pill being a milligram, you do the math. We're taking a lot of unwanted, unused medications out of the hands of the bad guys and putting them into an incinerator, which is great. I'm not sure if anybody was, confused about how the program works or what it encompasses. I do all the work. Myself and one other detective, Sean McGuire, do all the work. You drop it in that bin, you walk away. We get rid of it. What we do is we inventory everything, we weigh it, we take a report on it, we make sure that everything's in line, and then we contact the company out of West Wareham, Rochester area, Covanta. We schedule an appointment and we go and we burn it. And it's gone forever. Great program to have, particularly when the amount of unwanted, unused medications floating around out there. Just a couple of the key points I wanted to hear on, just to hit on with the kiosk. What is accepted in the kiosk? Prescriptions, prescription medications, prescription patches, prescription ointments, over-the-counter medications, vitamins, samples, and then most importantly for all of us, pet medications. You can get that stuff out of your house. What's not accepted, and in all honesty, I say what's not accepted is, Sean and I go through this box, and every single time we go through it, what do we find? Stuff that's listed right on top that's not supposed to be in the box. We still take care of it in the right way, so you don't have to worry about it. I'm not going to have you guys, if you're doing the responsible thing, if you mess up here and there, guess what? We all learn through our mistakes. Don't worry about it. What's not accepted is hydrogen peroxide, thermometers, medications from businesses or clinics, ointments, lotions or liquids, aerosol cans, inhalers. Easy enough to remember. And if you don't remember, I brought handouts here for everybody that you can take home with you. It says what the program is, how it's used, what we do, what's accepted, what's not accepted. I broke it down into real simple terms for everybody. One of the questions that Chris actually brought up was, a lot of people are confused about, can they bring other people's medications in? I can tell you right now, we do not have the resources, and even if we did have the resources, we wouldn't be doing it. We're not checking IDs at the door, okay? When somebody brings a bag of medications in and they drop it off, you'll see a dispatcher through the window who will probably say, hi, have a great day, and that's going to be it. So you don't have to worry about somebody bringing your medications in for you if you're not able to get there, okay? If you want to rip the labels off of the boxes, off the bottles or any of the patches, have at it. That's fine. I understand that. You can black them out with a magic marker. In fact, Chris had talked to me and we're putting a magic marker or a marker or Sharpie right on top of the container itself, just in case you want to scratch your name out, your personal information. But I can tell you, when you put it into that box, the only person or people that are going to see what's even on that label is going to be Detective Sean McGuire and myself. That's it. And we don't even look at the labels. We'll look to see what type of medication's in it, and that's it. We're not looking at the names. So don't be afraid to have somebody bring your medication in for you if you want to get rid of it. That's probably one of the biggest questions. Sharps are not, we do not take sharps. Right there, I'll point to the Board of Health does accept sharps. Yeah, we don't want to play with needles. We got enough to worry about. But there is a way to get rid of them through the Board of Health. Thank you very much.
Thank you.
My name's Erica. I'm the public health nurse for Dartmouth. I also am a visiting nurse for home care, Brandon Woods Home Care. I'll make this short and sweet because I know everybody's been sitting very nicely and listening. I'm here to talk about safe medication storage in your home. Going into the homes, I do see a lot of medication everywhere. Living room, bathroom, kitchen, right out on the table. So a couple of things to be aware, it's more of an awareness. When you have visitors in your home, you think that family members, children, would be the last people that you would have to hide medication from. That's not always the case, unfortunately. PCA workers, home health aid workers, homemakers, visiting nurses, anybody could go and snag up a medication when you least expect it. We want to make sure that your medication is stored properly. There are lock boxes that are available to be purchased at drugstores. they're not going to solve the problem of having somebody come in your home and ripping them out of your home and opening them up. But they will distract them from all the medication on the table out in the open. So not keeping your medication scattered around your home is a great idea, especially if you do have opiates, if you do have, if you have those medications that are addictive medications and that people unfortunately want. Like the detective said, we see a lot of you see a lot of the break-ins. They're after the drugs, not just your TV and all of your other valuables. Basically, that's really all I wanted to say. Do you have any questions for me? Okay. Does anybody have lock boxes in their home already for their meds? No. Some of the visiting nurses do encourage the lock boxes, and they are needed in some homes. And Chris will show you some of the options.
Just pretty much a plastic box.
Yeah, and you can turn it and take it off of the wall, right? Is that how?
Yeah, this one here will mount on the wall. And it's got a small lock, so once it clicks, it locks. It's not designed to stop the determined person. What it's meant to stop is that niece, the nephew, the grandchild from browsing. They see that vial of medication.
No matter how small or how big the grandchild is, the niece, the nephew, whether they're small, they're going to be inquisitive. They're children. They're older. You may not think that there's something going on. They see your meds and they take them. It could be anyone, not just, like I said, just because a person has a license or they have a title does not mean that they cannot take your meds or anything like that. So that's what we just want to be. You just want to be aware of who's in your home, where your medication is, because if they're all over the place, you can't keep track of them. Okay?
Lock boxes are relatively inexpensive.
I think with 20 to 25.
25, and they can go up depending upon the security level, but you can get them.
And that's not something that you're going to have to replace on a regular basis. And just a follow-up to the Sharps question, I believe it was that gentleman, the Board of Health, you can bring your Sharps container taped and drop it off with the Board of Health, at the Board of Health, I'm sorry, and they will give you another container, an empty container, is that correct? And you can fill that one up, bring it back, do the same thing over and over, okay? So that's how you properly dispose of the Sharps.
I'd like to thank everybody for coming. Thank you to Erica, Dr. Pope, I believe she has left, Detective Costa from the Dartmouth Police Department, Chris Michaud from the Board of Health, and a very big thank you to the Friends of the Elderly for sponsoring the delicious breakfast we had.